Bonjour à toutes et à tous. Bienvenue à ce point.
Hello, everybody, and welcome to this news conference with Premier François Legault, Health Minister Christian Dubé, and National Health Director Dr. Horacio Arruda. Mr. Premier, without further ado, the floor is yours. Hi, everyone. Listen, as you've seen over the past few days and weeks, we have put in place some measures that some people may find very difficult, and I know it's difficult to live with them, especially after a year. But luckily, when we compare ourselves to what we're seeing, for example, in Ontario, we can say that our measures are working for the time being. For the time being, the situation is still fragile. We have to be very prudent. And I want to come back to what's happening in Ontario so that everybody can understand. In Quebec, currently, we've got 694 COVID patients in hospital. In Ontario, they're at 2,360. Ontario is 1.7 times the population of Quebec. So we can see that the situation is very serious. We are reaching the capacity in hospitals in Ontario. I speak with Doug Ford on a regular basis. However, we must remain very prudent because in certain regions, we too are approaching our full capacity. And I want to talk to you of the three regions that are the most worrisome: Capitale-Nationale, Chaudière-Appalaches, and Outaouais. First, Capitale-Nationale. As we saw since the beginning of the pandemic, there's first an increase in cases, followed by an increase in hospitalizations, followed by an increase in deaths. We can see that the situation is stabilizing when it comes to the number of cases in the national capital, but we can see that it's continuing to increase when it comes to hospitalizations and deaths. Over the past 2 days, we've seen a net increase in Quebec of 15 hospitalizations, and there were 6 new deaths just in the last 2 days. And when we remember the increase in the number of cases in the past few weeks, unfortunately, we can think that we will continue to have some increases on that side. In Chaudière-Appalaches, same thing. We've seen over the past 2 days 7 net hospitalizations, 6 additional deaths in Chaudière-Appalaches, and of course, the biggest problem is in the Beauce region. In the Beauce, we had to transfer 5 patients over the past few days from the Saint-Georges-de-Beauce Hospital to Hôtel-Dieu in Lévis. In the entire Chaudière-Appalaches region, we are very close to full capacity for the number of patients in hospitals. In the Outaouais, first, the number of cases is stabilizing, but it's still quite high. When we look at the rates of positive tests, to give you an order of scale, the average in Quebec is 3.7% of the tests that are positive. In Outaouais, yesterday it was 10.9%. So it is the region where the rate of positivity is the highest. We've known for several years that the hospital capacity is limited in the Outaouais. That's why we will build a new hospital. We have to transfer some patients to the Laurentians, and there too, we're very close to the full capacity in hospitals. So I'm announcing, unfortunately, that we will have to extend the emergency measures in these 3 regions, the Capitale-Nationale, Chaudière-Appalaches, and Outaouais, for another week, so until Monday, the 3rd of May. What that means is it's a curfew at 8 p.m. Non-essential stores are closed and all schools closed. However, we're looking at the situation, we're following it very closely, and I can tell parents that we understand that in elementary school, it's very difficult to do remote learning. So the first thing, as soon as we have control of the situation, the first thing that we'll reopen in these three regions will be the primary schools. But currently, well, we know there's contamination, there's transmission in the schools. Even if the children themselves are at a lower risk, it has an impact on the family and on the community transmission. So we can't, for the time being, reopen the schools. Montreal and Laval, we're seeing that the number of hospitalizations and of cases remains quite high, but stable. And it's surprising. We could think, and when we look what's happening elsewhere in the world, the big cities, that is where we see the most transmission. But for the time being, there too our measures are working. I understand that Montreal and Laval, we've seen some reactions since we announced on Sunday, about 10 days ago, the 8 p.m. curfew. And of course, it's not ideal. We all understand that it's not fun to have to go home at 8 p.m. But for the time being, it remains that it's almost hard to understand how it is that the cases and hospitalizations have stabilized in Montreal and Laval. But we can't exclude in the next few days and weeks the fact that there may be an increase in cases in Montreal and Laval, and that is why we are following the situation very closely. In the other regions, we're at levels that are under control, but once again, we have to be prudent everywhere in all of the regions of Quebec because it can take a few days to explode, especially with the variants that are much more contagious. It's important, and I want to repeat this, all sorts of things were said on young people. When we look at the number of cases with the people under 60 years of age and we compare ourselves with the peak in April of last year in 2020, we've got twice as many cases of people that are younger than 60. The Minister of Health was saying said that I should say young adults because we're not talking about just very young people. But if you look, for example, yesterday in all of Quebec, there were 77 new hospitalizations. There were 35 who were people between 45 and 64. There were 10 where it was people between 18 and 44 years. And there were 2 where it was people between 0 and 17 years of age. So we can see, and it's been obvious for a few weeks, that there's an increase in the number of young people in hospital. You saw this morning in the media the young woman, the 24-year-old, the young mother, who's at Hôtel Dieu in Quebec. She's been there for 3 weeks. She can't eat, she can't walk, but she's 24 years old. So we must all remain very vigilant. The good news is that public health and the vaccination team is doing extraordinary work, and I'm pleased with this. I look at this almost hour to hour. Apart from Saskatchewan, we are the province that has vaccinated the greatest proportion of the population with 1 dose, and that means that our vaccination system is working well. Now, this week, we had some bad news. Ottawa announced that, unfortunately, we will have fewer Moderna doses, but we will get more Pfizer, so we'll be able to start vaccinating at a greater pace as of next week. Good news as well, I'm announcing that as of tomorrow morning, the AstraZeneca vaccine will be available for all people 45 and up. So if you're 45 years old and up, hurry up tomorrow morning. Go make your appointment. You'll be able to get vaccinated. And I'm repeating myself, it's very important. We got the okay from public health. The AstraZeneca vaccine is very safe and very effective. We're also continuing to vaccinate essential workers like teachers, educators, and this week, I think it's on Thursday, Christian Dubé will announce how we will proceed with handicapped people, caregivers. It's not simple because we don't want to start doing investigations to know if people are telling the truth, but Christian will explain this on Thursday, so we will also They will also be prioritized. And speaking of this, I want to come back because I'm hearing a lot of people saying, well, why aren't you opening to everybody? Well, because we've made the choice in Quebec to start with the people who are at greater risk, who were the most vulnerable. And that is a choice that we have made. That doesn't mean that we can't be effective. Yes, sometimes in certain places, there's no waiting, there are no people waiting in line, and there are some places that are available. But overall, we are vaccinating more than in the other provinces. And that allows us to respect a certain order and to start with the people who are at greater risk. So I'll end by telling you that, of course, our hope is vaccination. That is our passport to freedom, the freedom of seeing our friends again, our loved ones. We still have some difficult weeks ahead of us until the majority of the population of Quebec is vaccinated. So please, be prudent. When you have symptoms, go get screened. We are told that half of people don't go when they have symptoms, and it's important, out of solidarity, go get screened, and when it's your turn, get vaccinated. And that is how we will have a wonderful summer. Thank you. I'm counting on you.
Good afternoon, everyone. Over the past weeks, we've imposed tough restrictions to contain the third wave, but we see that those restrictions seem to be working. And we see that Quebecers are not giving up the fight on the virus. I cannot thank you enough for this. With what's happening in Ontario, we see how fragile the situation is. We're not immune to this in Quebec, but for the moment, we're able to resist. We have to stay very careful. We still have 3 regions where the situation is worrying: Capitale-Nationale, Chaudière-Appalaches, and Outaouais. The number of new cases is stabilizing, but hospitalizations are increasing. This is why I'm announcing that the special emergency measures will continue until May 3rd in these 3 regions. I know how difficult school at home is for the children, but there's a risk that will exceed our limit in hospitals. So we must do everything we can to reduce our contacts. And I can guarantee that the first thing we'll reopen will be primary schools. In Montreal and Laval, we're still resisting better than expected, but the situation is very fragile, so we must maintain the restriction. Elsewhere in Quebec, we're monitoring the situation very closely. The good news is that vaccination continues to accelerate, and will now offer the AstraZeneca vaccine to people aged 45 and over. I invite you to take this very efficient and safe vaccine. So the vaccine is the way to regain our freedom, but that will only happen when a majority of Quebecers are vaccinated. We have to resist until then to have a great summer. I'm counting on you all. Thank you.
Merci. Nous allons amorcer la période.
Thank you. We will start the question period. Question? Mr. Legault, when you say that half of the people who have symptoms don't go get tested, is that how we can explain the stability in the number of cases in Montreal and Laval? It's just that people are not going to get tested? No, because we see a stability in the number of hospitalizations. So if people became very ill, they would go to the hospital, and we can see that it's stable.
The
Mayor of Ottawa, Jim Watson, is asking that we remove the checkpoints with Quebec because, yes, it's creating some traffic. And for the people in the Outaouais and Gatineau, what do you have to say to this? What is your answer to this? Well, listen, when you look at the rate of transmission in Ontario, the number of cases, the number of hospitalizations, well, the situation is more serious in Ontario than in Quebec. So we are the ones who want to keep these measures in place. We want to make sure that people from Ontario don't come add to the contagion in Gatineau and in different other places in Quebec. Question. Hello. Concerning vaccinations, so we're deciding that for people 45 and over will have the AstraZeneca. Is it at 45 instead of 40 or 42? Is it for sanitary reasons or because of vaccine availability? The 45 was set by our experts at the Immunization Committee in Quebec. And the reason why that age was chosen and may change from one territory to the next, it's because of the incidence of the illness. And that is why, if you have a very high incidence, the benefits of vaccination can outweigh the risks at a lower age. That's why we chose 45 and up in Quebec, and that is also aligned with our data for hospitalizations and ICU. That's at that age that we see a net increase. But they are safe vaccines. You know that the UK used it even for people who are 30 years old, but we're using it according to our situation here. Mr. Legault, I'm sorry, Mr. Dubé. Contrary to the previous weeks, here what's important is the age and not the year of birth. I want to say that you have to be 45 years old to qualify for this. Mr. Legault, a more political question. So the budget was tabled yesterday. You saw it. So the famous question and the increase of health transfers from the federal government, you did not get what you wanted there. So this funding problem, will it create a risk when it comes to the quality of care or the sustainability of the healthcare system in Quebec? Well, it's the most serious problem for all the provinces and territories right now, the most serious funding problem. You know, we're asking for $28 recurrent billion for all of the provinces. So for Quebec, we're talking about $6 billion more. Of course, you've noticed that it looks like the recurring deficit for the Quebec government. So that means that the federal government is not helping us with transfers to settle a major problem. However, there's an amount. Well, the first year will be around $680 million and will increase to $1.8 billion recurrent for daycare services that we already have in Quebec. Now, we know that we've got a network that must be completed, but still we can say that in the $6 billion that we're missing, well, part of it, $680 million this year and $1.8 billion in 2025, could help us to solve a small part of our funding problem. I was pleased to see that even if the federal government is not minding its own business once again, that it's going to be done without any conditions so that we'll be able to have full compensation. Isabelle Porter, Le Devoir. Concerning AstraZeneca, we've heard quite a bit about the fact that women were at greater risk for the blood clots. Now, why not give different directives for men and women? And what can you say to women, younger women, to reassure them? And are there things that they can do to protect themselves if they get vaccinated with the AstraZeneca? The experts, when we look at the data, have demonstrated that above 45 years of age, it was not necessarily a segregation of gender to do. It's true that there were some cases with younger women in some countries, but currently we don't have any recommendations as to gender. The measures that women can undertake, well, one, get vaccinated, especially when there's a lot of transmission. So it's a safe vaccine. And of course, to add the other measures that are necessary, there are 4 important measures, right? I'll repeat myself again. So wearing of the mask, social distancing, hand washing, and now we're adding vaccination. Concerning the variants, we've been told for weeks that the variants are much more dangerous. There are some experts who say that we can't talk about 2 meters with variants, it's 3 meters now. When will we have clear guidelines when it comes to these measures, when it comes to variants? For example, is it still safe to take the bus or the metro at rush hour, given the variants? That's one example amongst many, but will we get an update on this soon? Well, we'll follow the literature. we must understand that already respecting the 2 meters is quite a challenge in our society. If we had indicators to the effect that we must absolutely do so, I think the measure, the 2 meters, the wearing of the mask outside as well, if we're at less than 2 meters, for the time being, that seems to be something that's working. But we must say that we have the UK variant, mainly in Quebec. We don't have a lot of the Brazilian and other variants, but it's something that we're following very closely.
Louis Lacroix, Cogeco Nouvelles.
Question? There's more and more experts who, when faced with outbreaks that occur in CHSLDs, they're asking that the second dose be given quicker in the long-term homes and the RPAs, for example, in order to try to make sure that we don't experience what we saw in the other waves in the CHSLDs. Is this something that you're considering? Well, first of all, I want to make sure, and thank you for the question, Mr. Lacroix, I want to reassure everybody. We will respect our timeline, that is, of giving the second dose within the 112-day delay as promised. That's the first thing. The second thing is that what may have worried people is that we had some delays with Moderna, and Moderna was one of the 2 vaccines that we had for the CHSLD. So now we're in discussions with public health, but I think it's going to be confirmed in the next few hours that we can alternate between Moderna and Pfizer in order to be able to make up the lack of Moderna that we've got in the short term to make sure that we respect our delay. So what I want to say the word reassuring, because it's important for us. At the latest, the 8th of May, all the people in the CHSLDs will have received their second dose, which allows us to respect the timelines that we had established. And once we've finished with the CHSLDs, well, then we can go on to the other senior residences, but we will respect our commitment despite the problems that we had with Moderna. Mr. Legault? Yesterday, Ottawa announced a pan-Canadian program for daycare that kind of mimics the one that we have in Quebec. Mrs. Freeland announced that there would be compensation for Quebec, but still it remains, and you brought this up earlier, that it remains, they're stepping over when it comes to the jurisdictions in provinces. So will you contest this program? Or the fact of having some compensation makes it so that for you it's okay that we receive money, even if Ottawa is coming into our jurisdiction? Well, Mr. Girard spoke with Chrystia Freeland, and there was a confirmation that there would be full compensation without any conditions. So that's the good news. Of course, we will continue to denounce this bad habit that Justin Trudeau has to want to centralize and to play daddy with the provinces. And it's true for the CHSLDs, and it's true, he decided to report this so that he wouldn't have any troubles for the time being. But this bad habit of centralizing, I think he should respect the jurisdictions of the provinces and territories.
Marc-André Gagnon, Le Journal de Québec.
Question. Hello. First question for Dr. Arruda. A few weeks ago, maybe a month ago, you indicated here that a person who's already had COVID is considered as being immune after having received only 1 dose of the vaccine. In other words, they don't need a second appointment for a second dose. But in the current context, where we have a lack of vaccines and a lot of people are asymptomatic, why not proceed systematically to a test, for example, when people do a blood test or when they give blood, to try to save some doses? You have to understand that the relationship between protection and serology is not always indicated, I don't know if you understand, we can have a serology that will be negative, but we're protected anyways. So simply said, we know that there are some cases of reinfection. We know that currently the recommendation of the experts is to give 1 dose and not 2 because the illness is like the first dose. And if we want to maintain their protection and make sure that they don't get reinfected and then transmit, that's what we're doing. So as I said, doing blood tests in several programs, we realized that doing serology to save some doses is even more costly in terms of serology and treatments for a benefit that is really quite marginal. When it comes to people who have chronic illnesses, the media, the pharmacists, and even the Ministry of Health, according to what I saw on the Facebook page, are still flooded with testimonies from people for whom it's not yet possible to make an appointment through Click Santé. So as of when will they be able to make an appointment on Click Santé? Is it in 1 week? In 2 weeks? When will they be able to get vaccinated in the pharmacy? And why not prioritize them with the AstraZeneca? Well, I will answer in 2 parts. The first thing is, I have a lot of empathy. We read all the questions, Mr. Gagnon, and that is why. Let's start by taking advantage of the good news, right? The fact that we've got additional Pfizer doses, a significant number as of the first week of May, brought us to sit down again with public health and to look at how we could broaden the group that you're mentioning. So we treated serious chronic illnesses, which were treated in hospital. That's what we announced a week ago. Following requests for chronic illnesses for people who are not treated in hospital. And I will also add another category, and that is people, handicapped people, whether they're intellectually handicapped or physically handicapped. We will clarify all of this on Thursday, because the good news that I've got for you today is that with the additional Pfizers that we'll be getting, we will announce this on Thursday. I want to be very clear when we make the announcement. The list will be detailed on our website, and people, as of Thursday, we will give a precise date where people can start to make appointments. So the good news today is that we've got additional vaccines from Pfizer. We will make sure that we broaden the category of chronic illnesses and of handicaps. And the good news is that as of Thursday, when we'll make the announcement, we'll be able to prioritize these people before the general population, because in theory, when we had made the announcement last week, they were part of the general population. Now what we will give them is a priority versus the general population before we open it up to everybody. So that's good news. And we can do this thanks to the additional Pfizer vaccines that we will be getting as of the 3rd of May. Not necessarily in pharmacy. There will be more places where they can get the vaccine. So we made that decision this morning. We still have to prepare all the details. So on Thursday, we will explain it properly, and we will have a special news conference on this point, because we have a lot of empathy. We had a lot of requests for this, and we will find the right way to proceed. Question. I'll continue on that. So you agree that the category that was put in place by the committee was not very clear. I wouldn't say that it's not clear, but it was limited because of the number of vaccines that we had. What we have to say is that, I'll give you an order of scale. We had said, and that's always a problem, right? How many vaccines do we have? And can we have a specific category? The specific category was category number 8, as explained by public health. And that was people who were treated in hospital. That was the category. And I'm repeating myself now that we have more vaccines coming in, well, instead of going, from 8 to 9, 8 is chronic illnesses and 9 is essential services. Well, now we said, well, because we've got a lot more vaccines, almost 1 million more, it's 230,000 more per week for 4 weeks in May. That's 920,000 vaccines. So these 920,000 vaccines, before we open them up to the general population, we will say exactly what we will do when it comes to chronic illnesses. So we will add some chronic illnesses. It's very important. And we will also add physical and intellectual handicapped persons. So it's going to be more precise, and that's the good news, and we will clarify all of this on Thursday. We're going to do it once, and it's going to be clear. I also want to come back to a question from my colleague Isabelle. How do we protect ourselves right now from the Brazilian variant in BC? Because right now there are people who are planning their summer vacation, and they say, well, perhaps we can't go to the U.S. or abroad. Well, we'll travel in Canada. So are there measures to stop people from BC coming here and vice versa? Well, we said it. Right now, the recommendation is to not have any non-essential travel towards other provinces, so them to us or us to them. And I would like to tell you that we've got discussions that we will be having with the federal government and with the other provinces in order to avoid the importation of these variants that are more worrisome, especially the Brazilian variant. So I think that the best protection, what I can tell you, is to not go. Well, we'll have to see. Will there be certain control elements for travel, especially if the situation continues to be exacerbated in BC and in other provinces. So we're having these discussions with the public health directors in other provinces, but I think that we'll have to take a position on this quite quickly in terms of measures. We have done some terrestrial checkpoints between Ontario and Quebec, but, airplanes are also another mode of transportation. We have to look at what kind of controls we can do there, either through tests or otherwise if the situation deteriorates. Question? Hello. First, on the age for AstraZeneca, there are some problems. If we choose 40, we're going to 45. There are some provinces that are choosing 40, we're choosing 45. So first of all, where is the opinion of the immunization committee? Because we haven't seen it, and you're making an announcement to this effect. Second, and second, the exact reasons why certain provinces go to 40 and we're not going down to 40. Well, the opinion will come out this afternoon from the CIQ. We got it under embargo, of course. The reason why, and it's the experts who have decided that it's at 45 years of age. So when you're 45 and up, you can get the AstraZeneca. And it's based on the risk analysis versus the potential risk of coagulation and blood clots. With the incidents that we have currently in Quebec, when we look at our data, like what are their age groups that are being hospitalized or that go to ICU, the 45-year limit seems to be the right number for Quebec. If we were in Ontario, for example, with a much greater incidence, well, then the risk of being hospitalized and of having complications is greater. So then the risk profile is not the same. So by going to 45, and we also have to take into account the number of doses, but our timeline or our age is 45 according to the situation in Quebec today. If we found ourselves in a situation where there was an increase, a significant increase in the incidence of the illness, we could come to a decision to go lower. But it's truly a risk calculation, and it varies from one territory to the next.
En profiter pour que les Québécois savent ce qu'on offre à compter de demain matin.
So as of tomorrow morning, we've got a little bit less than 200,000 AstraZeneca doses throughout Quebec. And the two categories that were just added, so people from 50 to 55 and 45 to 50, that's more than 600,000 people who were not vaccinated. So if I add those who are in our target population, another 200,000, it's approximately 800,000 people who could get the AstraZeneca. So I would tell you that as of tomorrow morning, get up early because it's going to be, the appointment sites are going to be very active because it's around 800,000 people for 200,000 vaccines. Mr. Premier, what do you conclude of the opinion on Bill 21? Well, I'm a little bit disappointed with the ruling. I don't think it's logical. Currently, it's as if secularism and values were applied in different ways between Anglophones and Francophones. In Quebec, we protect the rights of Anglophones to get services in English, but now it would protect
des valeurs différentes pour les anglophones que les
you
francophones.
values differently for Anglophones and Francophones. So I think that in Quebec, all Quebecers,
Pour tous les Québécois,
for
il
all
devrait y avoir
Quebecers, there must be
des valeurs communes.
common values.
Et je comprends pas.
And I don't understand the ruling.
Puis il va peut-être nous autres.
And
va falloir peut-être nous autres
perhaps
poser
we'll
des
have to
questions
ask ourselves some
pourquoi
questions
les
on the why
des anglophones
are the
au
rights of
Québec d'avoir
Anglophones in
une
Quebec to
scolaire,
have
des
school
services de
boards
santé,
or health care
puis
services in
avoir un
English.
impact.
How does this have an impact on our values, our common values?
Forêt, TVA Nouvelle.
Question?
Monsieur le Premier ministre,
Mr. Premier?
Dr. Arruda, je vais vous poser une question.
I'm going to ask you a question, Dr. Arruda. If 49% of schools in Quebec don't have sufficient ventilation, are they safe?
Est-ce qu'elles sont sécuritaires?
Are they safe? Well, I think that it depends. There's not just ventilation that is a factor that allows to protect young people. That's one of the factors, and I think that what we're aiming for is to improve the indicator as to the number, the quantity of ppms. But with the measures that we're putting in place, we know that schools here, like elsewhere in the world, it's an environment where there's transmission because there are close contacts between students, etc. But I would tell you that it's not the main factor. I don't want to say that it's not important, but I would also say that the benefits of this will also be to improve the quality, the air quality in a general manner in schools. But right now, depriving children of presence in school would have much greater negative impacts than an increase in cases that may occur. And there are ways that we can prevent transmission. Mr. Premier, you spoke about this in your opening remarks, and you talked about the explosion of cases in Ontario. Do you have a guarantee from the federal government that there will not be a transfer of vaccines towards Ontario, given this increase in cases? And where are you when it comes to helping Doug Ford? We know that with healthcare personnel, it's not possible, but are you working on something with him? Well, first of all, Mr. Trudeau has repeated several times that the allocation of vaccines between provinces will be done according to the pro rata of the population, so there's no reason to believe that there would be a change to this. Second, well, you know, we are tight with the vaccines, especially when with staff, especially when it comes to nurses in Quebec. And yes, I had discussions with Doug Ford over the past few days, but still, I'm going to keep these discussions private. For the time being, we are not thinking about sending nurses to Ontario. Question? I'll come back with another question on AstraZeneca for Mr. Dubé. This weekend in Montreal, there's a quarter of the available doses that were administered. So what role, beyond, what role did this play, the lack of popularity in a certain age group for AstraZeneca in the decision that you're making today? Well, first of all, it's a good point, but the decision of the sick has nothing to do with us, with the ministry. I want to reassure you. But what happened with the 55 and ups, the more we vaccinate people, we started 10 days ago, we had 411,000 doses. So it was a small portion of the population, approximately 600,000 people, so the 55 to 60, some had already been vaccinated elsewhere, sometimes in a CHSLD or in a workplace, or they're healthcare workers. So we were getting closer and closer to our target zone, and that is at each age group, as you know, we're aiming for 75% of the population to be vaccinated. So it became a little bit, we were like fighting against ourselves to try to convince people who are already convinced, because what we had remaining was really the top layer of the 55 and up. And that is why today I'm clear with Quebecers that now we are opening 2 new categories which will go before the general population because the AstraZeneca is available. And so what we've got remaining from these people who did not get vaccinated, they still have the time to get a vaccine. But now we're talking about 600,000 additional people who will be able to take advantage of this opportunity. So I think that we were at that point, and that's why we had asked public health. And I'll tell you that we're not the only province who made these requests. Ontario did the same thing, BC as well. So today I'm very pleased, and especially having two age groups, and that is we're reasonably sure that there will be a lot of appetite for this vaccine because we saw with one age group we went through more than half of the vaccines that we had. My second question for Dr. Arruda. We mentioned it earlier, and you were asked a question indirectly. Montreal and Laval, things are going well. It's stable. Mr. Legault is repeating that it's hard to explain. Do you have... Well, can you explain what explains the situation in Montreal and Laval? Well, we must say that Quebec, even if people have the impression that we're doing a lot of easing of measures, these are significant measures. The curfew, and I would tell you, when we compare ourselves to other regions, so I think that's one of the elements. The metropolitan region is a region where people went through a first wave that was very intense, and it happened between the first and the second. There was at some point in the regions that were less impacted, there was an increase, a quicker increase in cases. So I think that there's not just one factor that explains the situation. There are several. So there's vaccination happening, but perhaps it's not enough to explain the situation. It's probably the behavior of individuals, the number of social contacts, very good contact tracing being done in the metropolitan region. It's very intense. So it's a series of factors, but as we say, I'm happy. I can tell you that every morning, when we get our data, we look and we're trying to see if it's starting to increase because we can see what's happening in Ontario. So what I recommend to people is to not give up. And we have to continue our efforts until we have enough people vaccinated so that we don't find ourselves in a situation that is completely destabilized as we're seeing in Ontario, and it can happen very fast. Question? Mr. Dubé, to be sure, AstraZeneca tomorrow morning. It's by appointment in the big vaccination centers. So we're talking what they can start at midnight, at 6 a.m., because when you say 800,000 people for 200,000 vaccines, well, that's why I'm mentioning it. First, we will continue to do the hybrid version, that is, with appointment and without appointment, because we've seen with what happened over the past 10 days that people appreciated having the flexibility of doing a walk-in. And we're telling you, in the no appointments, there's going to be some wait lines, that's for sure. But that's the choice that we've made. I would invite people, as of early tomorrow morning, to make an appointment. The appointments will be available probably at midnight, as we usually do. So I would tell you to take advantage of this opportunity. But the vaccine will be offered by appointment and without. Mr. Legault, you say that we won't have fewer vaccines given what's happening in Ontario. For the time being, we don't want to send any nurses. Could we welcome some patients? I mean, I understand these are private discussions with Mr. Ford, but what are the types of requests he's making? Because they're in trouble right now. Well, I prefer to keep our discussions private. Could we be getting some patients from Ontario? Not for the time being. Not for the time being. Nice try. So we'll now go to the English questions.
Good afternoon.
Vous pouvez y aller, Monsieur Autier, on vous entend très bien.
Merci, Monsieur le Président. I'm just wondering, with these situation that with the restrictions for Ontario and Quebec, Premier, have you given some thought to closing or barring air travel from other Canadian provinces into Quebec airports?
We have discussions between ourselves, including between Doug Ford and myself, about traveling between provinces. I was happy to hear a few minutes ago that the federal government decided that the measures for international flights will be on until the end of May. of course, we worry about flights coming from countries like India and Brazil. So I have discussion with Doug Ford and with the federal government to be sure that international flights measures quarantine, that the quarantine is really respected. And also, we're looking at the possibility of maybe doing more for on-ground travelers. Is that the way we'd say that? On-ground travelers, yeah.
Okay, thank you. And with the situation in Montreal and Laval seeming stable, is it impossible, or are you ruling out, or are you considering moving the curfew back there to 9:30 p.m.?
Not for now, but of course the situation is stable. So it's still very high. The number of cases and the number of hospitalization are still very high. We don't exclude anything for the next few weeks. If it's possible to put the curfew in Montreal and Laval at 9:30, would do so. But right now, we think that the situation is too fragile to change the 8 p.m. curfew.
Raquel Fletcher, Global.
Good afternoon.
Good afternoon.
My first question is again about people who are chronically ill. As you yourself mentioned, we have received a number of calls and emails from people as well as their family members who say they are being shunted from doctor to specialist to pharmacist and back, and they're being turned away at vaccination centers. They tell us that it's a mess. And just recently, they also sent people to watch a video in French to explain what appears to be a very complicated system. However, that video is not being translated in English. Can you just address what seems to be very complicated for some reason?
Well, first, I think the first reason why people were unhappy is there were not that many people on that initial list that we published last week. And I think, as I mentioned earlier, the good news with more vaccine, especially with Pfizer that will be received as of May 3rd, we have, in conjunction with discussion with public health, to increase the number of people that will be allowed to have those vaccines in the coming weeks. So instead of and to make sure that we're very clear, and we have a lot of empathy for those people, either on the side of chronic disease or on disabled, whether it's intellectual or physical disabled, we will clarify all those positions and we'll make a very clear announcement on Thursday. So I think I just ask for your patience, but given the good news and the reassurance that we got from Pfizer that those additional vaccine will be available as of May 3rd, we will put some additional appointment on Thursday, and I will explain that in details Thursday.
Thank you. My second question is for Premier Legault. You said in French that you are concerned about the judgment on Bill 21 because it gives different rules to English Quebecers as opposed to French Quebecers. The judgment did uphold most of Bill 21. What is the concern that you have that English school boards will be exempt? Is that really that big of a deal?
First, I don't see any relationship between the language and values, including secularism. So I don't understand why a judge said that Anglophone in English school boards can have different values than the other Quebecers. I think we cannot divide Quebec in two. We need one Quebec with one set of common values.
Merci. Nous passons maintenant à Cathy Sonu de CBC.
I just would like to go back to AstraZeneca and the fact that the magic number in Quebec is 45 years old. Can you go back to this explanation, and what do you say to women taking the birth control pill?
Well, in fact, we know that for the second question, women who are taking the birth pill, especially if they smoke, there is a higher risk of some clots, and women are always at higher risk because of a hormonal process. But I think that the risk of getting the disease actually from COVID-19 and even having clots is higher probably than, I would say, the risk with AstraZeneca. To the age issue, it has been recommended specifically by our experts in immunization, and they are taking into account the epidemiology and the incidence rate which is going on here in Quebec. If we compare to Ontario and other provinces, there is a higher rate actually. They have more cases every day than we do here in Quebec. And balancing the risk-benefit of the vaccine against the possibility of having clots, the age and in relation also with hospitalization that have been identified in Quebec is 45. If things change, if our epidemiology gets worse, we could lower the age. But actually, based on the information we have, our specific epidemiology, it is 45 years old, exactly when you get your 45 years old and older.
And regarding the emergency temporary measures, when you announced them, it was to start on April 1st, and it was supposed to last the week following Easter, so about 10 days. Now you have to renew those measures, and it will be like a month next week, Monday next week. What's wrong?
Unfortunately, the situation in hospitals in those three regions is very worrying. Right now, the number of people hospitalized increases every day. So, unfortunately, we have no choice but to put and take all measures to reduce the number of contacts, including for children. But as soon as we'll have the okay from public health, we'll open first the primary schools. I understand very clearly that it's tough to have this kind of training at distance for these young people.
Merci. Angela Mackenzie, CTV.
This is for Minister Dubé. You touched on this in French earlier. There's calls to give second doses to seniors in the CHSLDs. Some of the options that doctors are asking for are either to redirect Moderna from pharmacies or to approve giving Pfizer to someone who had Moderna as a first shot. Are any of these options on the table?
Yes, but we are just waiting a final approval from public health to make sure that we can do the substitution. But I don't think that will be a problem, because our issue right now is the late arrival of some Moderna. So to make sure that we make the engagement of respecting the 112 days, we might need to do a switch, but those are two ARN vaccines, so we're just waiting for public health to give us the okay, but I think that will be all right.
Are you looking at all at having it sooner than 112 days?
We would love to do so. If we have this okay of substitution, the sooner the better we can do it. I just said we're committed to the 112, but if in any cases when we get into that CHSLD, we'll try to make it within the 112.
Thank you.
C'est ce qui m'a fait un point de presse. Merci beaucoup. Bon après-midi.
Merci beaucoup.